for a truly satisfying, unhindered lifestyle. We in the Nintendo Immune Tolerance Project have been investigating ways for organ transplant patients to avoid a lifelong dependence on immunosuppressive drugs. In the course of our research, we discovered a novel immune cell therapy we named Induced T cells with suppressing functions. Immune rejection, the biggest problem following transplantation, damages the transplanted organ, destroying its physiological function. Our immune systems protect us from disease-causing microbes or other invaders by recognizing them as foreign targets to eliminate. When the immune system recognizes the transplanted organ as foreign, a severe immune rejection is triggered. To prevent or reduce the risk of rejection, all organ transplantation patients must take several types of immunosuppressants after receiving a donor organ. To date, a small number of organ transplant patients have been reported to be free from rejection, even after weaning off of immunosuppressants. This special condition is called transplant tolerance. Our Nintendo University research team has discovered a new method to artificially induce transplant tolerance by using induced T cells with suppressing functions, or ITS for short. Lymphocytes from the patient and the donor are harvested and cultured together to generate ITS. Through this process, patient immune cells are educated not to attack, but rather to protect the transplanted organ from donor. When these suppressive T cells are infused into the patient, the T cells help form immune memory for tolerance to the transplanted organ from donor. If this happens, we can expect to reduce the dose or to wean the patient entirely off of immunosuppressants without organ rejection. What's involved in the treatment process to induce tolerance? We are currently conducting a clinical trial to investigate the efficacy and safety of this therapy in patients scheduled for living donor liver transplantation. Let's run through the 4 major steps. Before liver transplant surgery, immune cells are collected from both the patient and the donor via apheresis to remove other blood components. Step 2. The harvested cells are transported to the cell processing facility at Nintendo University Hospital. There, the patient immune cells are cultured with irradiated donor cells in the presence of CD80 and 86 antibodies, which inhibit T cell activation that would initiate the immune response. In this way, induced T cells with suppressing functions are generated. Step 3. After living donor liver transplantation, suppressor T cells are infused. Prior to this infusion, cyclophosphamide is given to the patient to stabilize the ITS function. Over the next year and a half, the amount of immunosuppressants is reduced step by step while carefully monitoring for rejection until weaning is complete. Step 4. After weaning from the immunosuppressants, we will continue to check for 1 more year that the patient maintains a state of immune tolerance. There remains much to learn about how tolerance is induced and maintained. To achieve a new era of freedom from immunosuppressants for patients of precious donor organs, we will continue our efforts to develop this immune cell therapy.